Back with Dr. Hawary. Dr. Hawary, lots of people have missing teeth. And, well, actually, when they have missing teeth, they have them usually missing in the back. Because in front, not a lot of people have missing teeth because that looks ugly. And people do still fix them rather fast. However, when people have missing teeth in the back, the dentist keeps telling them all the time, you must replace them, otherwise all havoc will break loose. On the other hand, as patients, we have noticed that we have a few missing teeth for a few years already, and nothing bad is happening. Shed some light on us. Tell us where this apparent discrepancy come in. We don't feel any pain, no problem, and you keep telling us we gotta spend money to fix it otherwise. So what's going on here?
Well, teeth tend to move where is a gap in general. So even though you're absolutely right, you don't feel excruciating pain if you're missing a tooth, but things are moving slowly. The tooth above the gap is super erupting, which means it's moving down, and vice versa. If you have the gap on the top, the lower tooth would move up, and the teeth next to the gap will lean forward towards the gap.
Like a fence ball, which, not a fence ball, a whole fence where one or two balls are missing. Next thing you know is they go a little like this, and then they come up and down, and they go away, and they start looking ugly. And maybe more importantly than ugly, some fences have a functional purpose to not to let things let things come in, and they lose aesthetic and they lose the functional.
Absolutely. When teeth lean in one way or another, or super erupt, or move, out of their socket, a lot of problems comes with that. Occlusion, which is your bite, would be changing and not balanced, and started to hit one side more than the other, or a certain tooth before the others. And that leads to a lot of other problems that people don't understand why it's coming, like I have headache, or I have muscle pain, or things like that. And it's mainly happening because the teeth are moving out of alignment and the bite is out of balance.
When you say the bite is out of balance, Dr. Hawary, when you say the bite out of balance, what exactly does that mean? Again, I'm come from an engineering background, and I see that we have some hinges here. You might call them something different, but to me they're hinges. And by bite, you mean the mouth going up and down, and it becomes like, it becomes out of alignment. That's what I would call it, something like that.
Yeah, in ideal world, there is a joint where we open and close in a very simple lay words, and this joint should be in a good position. If one side is hitting more than the other because the teeth are moving and you're hitting more on one side than the other, then the joint would move as well, and it causes a lot of out of alignment and out of balance problem that causes joint pain and bruxism, which is a word that we use when people start clenching a lot on their teeth because the joint is not in a relaxing, perfect position, normal position that supposed to be, because the teeth let it out of alignment.
And that you say, Dr. Hawary, that you say also causes headaches and neck tensions and shoulder pains and stuff like that?
Exactly. Which people sometimes don't relate to teeth, but it originates from the missing teeth that leads to that.
Interesting. So, obviously, and it's no real surprise. The whole body does work together, but it's no surprise that the head, which has so many important things in it, from the brain to the eyes to the nose to the, there's so many important things in it that those hinges and the teeth are not less important, and they're all connected. So tell me this. If a person, you say headaches and stuff, so if a person, let's just say, has had headaches for a while, and maybe he went to a chiropractor and other ways of fixing it, and maybe it helped for a while, maybe it didn't, and anyway, he still has headaches. would it be wise for him to visit a dentist and say, I have headaches, can you check my bite, regardless of whether he has missing tooth or not? Because I'm sure one can get a out of alignment bite even without missing teeth. There are probably other reasons also. But especially if he has missing teeth. But what about if he don't? Anyway, a person who didn't get rid of his headaches and didn't yet visit a dentist, should he go to somebody who is knowing about those things, specialized in arranging the bite, not just pulling a tooth and filling teeth, but is specialized in that, and see whether that is the problem?
Absolutely, because a lot of the headaches that happens because of tension in the muscles, okay, and a lot of those muscles, are becoming more tense, okay, because of the clenching on teeth that happens because of many problems. One of them, as we talked, is the missing teeth. However, it can happen because one person grinds at night a lot and grinds on one side more than the other, and some teeth are getting shorter than the other, and the same thing happens. Teeth are out of balance, and the joint is out of alignment, and that causes the muscles to be very tense, and that causes the headache as well. So it definitely won't surprise me that a lot of patients don't know that, but it is a very important thing that they seek help from a dentist that check the bite and the joint and make sure that it's not originating from the teeth.
And if it is, it can probably be fixed.
Oh, absolutely.
Thank you very much. Very informative. I appreciate your information here very much, Dr. Hawary. Bye-bye.
Thank you very much.